Okay, hi, my name is Jamie and I'm a massage and shiatsu therapist here at Zen Experience Massage and Wellness.
How do your clients react to laser therapy?
Our clients always have a positive reaction to the laser therapy because you get quick results, is one thing, and there's no pain. So the results have been very positive. I know that this power laser works. I've done it on myself. Let me explain to you and share with you my experiences that I've had. And then we get them to come in and have their appointments, and then they're like, oh yeah, it does work.
Right.
This is great, so they do have positive reactions afterwards, which is what we're looking for.
Right.
We want to help all of our clients that walk in the door, especially clients that are in pain, and they've tried surgeries, and they've tried physical therapies, and they've tried acupuncture, and they've tried chiropractic, and they're taking over-the-counter pills, they're taking prescription meds constantly. They don't want that. A lot of people are looking for instant gratification. This is pretty close because you don't need to have this done for 3 years before you start, feeling pain relief coming through. Like I said, I felt mine. It was probably about I would guess at least 50% decrease in pain after my first treatment. So when I tell that to our clients, they're like, you gotta be kidding me. I'm like, you have to try it. Let's give this a go.
My name is Ann Thelman, and I happened to come to Zen because I've been having a lot of hand pain. I had seen an orthopedic surgeon, and I couldn't do cortisone injections due to allergies and drug reactions. So I came in and I spoke with the therapist here. Her name is Jamie, and she explained the treatments and what they consist of, the safety and efficacy of the cold laser treatment. She recommended between 12 and 15 of the treatments, and it's been like a miracle for me. The swelling in my hands, as you can see, is practically non-existent. My hands were twice this size. The pain was so debilitating for me. I couldn't open a water bottle without using pliers. I couldn't open my car door, opening and closing doors, brushing my teeth, flossing, trying to wash my hair and use a hair dryer. The pain was excruciating. There wasn't much hope for me till I came in here, and after completing the treatments, I'm thrilled. It's like a miracle for me. My hands are normal, they're not swollen, they're not discolored. I can open water bottle without thinking about it. I can do my hair, use my hair dryer again, opening and closing doors without even thinking about it and not experiencing the pain. So for me, it's been a real miracle.
We are going to be starting a treatment here for Ann. We're treating Ann's hands today for some arthritic pain. I already have all my settings going here, so let's just get this started. And now Ann doesn't feel anything. There's going to be just a little slight vibration, but she's not feeling any heat or any pain with this laser. I listen for the beeps, and the beep is telling me every time I hear a beep to move to the newest location. And this is going to take just a few minutes, and we're treating some of the areas where she's actually feeling localized pain. And how you feeling there, Ann?
Feels great.
Good. And because I've treated Ann before, I know really all the areas that hurt her, and but we would talk to the client first and foremost and find out, where is your pain? Are we going to be treating local points? Are we treating tender points? Are we treating acupressure points? Are we treating trigger points? There's many different points that we can be treating. And with Ann's condition here, what we're going to be doing is the recommended treatment protocol is going to be anywhere between 12 and 15 treatments. And if Ann can come in 3 to 5 times a week, we're gonna be on schedule here with this. And she should notice something right away. What the Pro Laser is doing is, it's increasing energy that's the body produces naturally to promote healing a bit quicker. Let's have you just rest your arm there. That one is all done. And we're just gonna give it a little bit of a rub down afterwards, manipulate the tissues there. You doing okay, Ann?
Feels nice and warm and relaxing.
Good. Give a little bit of a hand spread there. And let's flip it over there and feel. And that would be just one treatment there for the hands. All right, we're gonna be treating Ann's leg here. The main treatments that we're doing with the 1500 today was for edema. Now, Ann had an injury.
About 2 years ago,
Okay.
I slipped and it caught between the garage and the decking. And for the last 2 years, it's been really hard. It doesn't feel soft or subtle. A lot of restricting movements and a lot of swelling. A little discoloration in it for over 2 years too. So
It was, and now it looks so much better already. We're still going to follow up with treatments here and finish up our series with the 1500 as well as the 500. The laser is increasing endorphins, which is going to promote
Okay.
the healing. We're taking down inflammation. We're reducing pain. So I already have my settings all adjusted here, so we'll start this here. Before, we couldn't really see any definition in the ankle with Ann. It was just one big leg. The texture was completely different. It was very hard and cold to the touch. Let's get it around here. Now the skin is nice and soft. Now the connective tissue, we can move it. Before, there was not much movement even in the connective tissue because of so much swelling. The swelling went down into the top of the foot as well, and everything feels much better. Let's make sure we get this whole. Now I'm using the 1500 on the leg because we have a bigger area here
Okay.
versus the 500. We could use the 500 as well, but because we're working this whole area right here, the 1500 is going to hit a bigger area for us. And this treatment only takes a few moments as well. The recommendation was 2 to 3 times a week for the leg versus 3 to 5 with the hand. And I think we've just been hitting the leg every time we've worked on the hand
Right.
as well. That's probably why this has been doing so good.
I have no pain in it right now. So
Good.
It's huge improvement.
And those were the goals. One's to reduce the pain and to reduce the inflammation. So we've hit those goals already, and we're going to continue with the treatment protocol and finish it up. Even the color. The color of the skin was different before, and now it's a nice pink.
I noticed both feet are the same color now. It's
That's always a
great.
plus.
It's a good plus.
And the same with the 1500. She should feel no pain, correct?
I don't feel anything. It just feels warm and soothing.
Okay. And like I said, there's a little bit of a vibration with the power laser. But other than that, you really don't feel anything. Leg feels good. Let's turn that off. Everything feeling okay?
Feels great.
Good. That feels really good. I'm just gonna have you bring it straight out for me, if
Okay.
that's okay. Is that
Yep.
comfortable for the
Yep.
knee there? And just relax the foot. And that's the treatment that we've been doing for Ann on some edema.
I've already recommended laser therapy to about 10 people, family members, friends, anybody who will listen, and telling them and the success that I've had and just looking at my hands and showing it to them. I'm thrilled. So.